we've just explained from the past slide the optimal alignment of joints, the kinetic chain points. Joints are stacked together and muscles are supporting each other from both sides. This next slide, we're going to be talking about what causes postural misalignments. And possible causes of this are when muscles are not returning to normal resting length. When this happens, muscle on one side of the joint can be overactive or short due to postures we hold with those muscles. And because muscles work in pairs, the other side of that would be lengthened and underactive. And that will take us to the next slide, just having a visual of what are the common postural misalignments that we see with the upper body and the lower body. So I will encourage or invite the audience or your attendees to stand up and hold those two postures and ask them where they feel it. And have them relate to them if there's someone that sits on their desk whole day or they're doing their work in a standing position, and have them just have their feel in the postures and identify which muscles would feel short and which muscles would be lengthened. And now that we have identified what are the overactive short and underactive long muscles, now let's look at the guiding principles for overactive and underactive muscles. These are the rationale or protocols. How do we address the overactive muscles? For overactive, we wanted to do self-massage first. Is that to inhibit that, to quiet them down. And we use the foam rollers for it or lacrosse balls to soften the tissue. Then once it's softened, we're ready to stretch them to elongate those muscles. That's how we address the overactive shortened muscles. Now on the other hand, because we have to work in pairs, we address the lengthened underactive muscles. We activate them because they are switched off. Activating means to turn on, switch them on. And that gives a perfect balance on the posture. If we loosen and release this overactive short muscles, we wanted this to be ready also to be prepared and turned on, so it creates balance for the posture. So ultimately the goal is we wanted to get results by addressing the root cause instead of chasing symptoms.